into Good Morning Arkansas. We're doing something a little differently today with our St. Vincent segment. Today we have athletic trainer Jeff Stotts in to talk about sports injuries. And this is kind of a whole new area of medicine, isn't it, Jeff?
It is. It's National Athletic Training Month in March, and we're trying to get the word out there that it's bigger than just the kind of glorified water boy that it used to be back in the day. We are a medical profession. We have a board of certification exam that we have to pass, and we really try to make it known to the public that we're more than just the trainers. We do more than tape ankles. We take care of preventative care as well as rehabilitative.
That's great. And you work at Mt St. Mary's as well with the kids there.
I'm the head AT there and work with all the sports and take care of any of the injuries that pop up, and then also take care of preventative care for them.
Very good. Yeah, let's talk a little bit about some of the most common injuries you see. I guess we're coming out of football season, of course, but into baseball season now.
You know, I'm lucky that working with all girls, I don't have to worry about football too much. So I get to stay inside in the cool air during the summer.
Yeah.
The number one thing we see probably is sprained ankles. I mean, it's just a general number one injury you see. We get a lot of muscle strains. The big thing I always have to clarify with people is there is a difference between a sprain and a strain.
Okay.
And so a sprain is an injury to the ligament. It's when you turn your ankle, you injure the ligaments, while a strain is damage to the muscle or the tendon. So you can hurt a muscle by overstretching it or pulling it, and that's a strain. The big thing is just focusing on taking steps to try to prevent those injuries from occurring, and then when they do happen, controlling it so that, you know, sometimes the body's line of defense does a little bit of overwork and can actually do more damage than good. So trying to control things and helping out a little bit.
Exactly, and listening to your body too. You were just talking to somebody about that.
Yeah, the big thing is if there's pain, that's your body's way of telling you, hey, I don't like what you're doing, and maybe it's time to take a clue from your body and say, hey, maybe I should back off a little bit. Some people there's that old mentality of push through the injury, try to get through it, and that can actually do more damage than good.
So listen to your body. If there's pain, there's probably damage. Hey, if you want to give Jeff a call, do it right now at 1-866-GMA-TALK. But like all the doctors and nurses who are here, he gets questions from the studio while you're watching commercials. So Alan Bennett said, hey, I have a hamstring injury a while back, and he's kind of still having trouble running. What would you say to that?
Hamstring injuries are probably one of the number one muscle injuries we see. It's really a big, important role in running and striding and increasing your stride length. And so what happens is the hamstrings are actually a knee flexor, and so they are responsible for bending the knee, and you can get little pulls in there. The big thing with that is, you know, if you feel your hamstring tighten up, try some ice afterwards, maybe some ibuprofen or Aleve. Those are anti-inflammatory medications, so that'll help a little bit with more than just the pain. And then I also just really try to tell people, don't just focus on your hamstrings. Just because your hamstrings hurt doesn't mean there's not maybe a muscle imbalance somewhere else in your leg going on. So try maybe stretching out your quadriceps, doing a glute stretch for your rear end, and trying to take some of this pressure off of the hamstrings, because sometimes a tight lower leg and lower extremity can lead to imbalances and other problems more than just where the injury is occurring.
And he said, Alan, I'll show you some stretches in a minute. So we're going to do that a little bit later on too. But let's just talk about, when is it time perhaps to go to the emergency room after an injury? When do you think you need to do it and not kind of wait?
If the injury is lingering, it's something that, you know, several days have passed and it's still very painful, it's excruciating pain, you know, I would recommend that's when you go to the emergency room or contact your doctor, your orthopedic, and consider going in. The other thing is, if it's bugging you at night when you try to go to bed and it's still, you can't sleep comfortably, you know, sometimes even with medication you can at least get to the point where you can get comfortable enough to sleep. But if it offsets your sleep patterns, that's maybe some time to take a look and get some outside opinion.
Yeah, tell us a little bit about the ladies there at Mt. St. Mary. How many sports do they play?
I think we've got 7 or 8, maybe more than that.
Yeah.
The great bunch of girls. If you would have told me when I got into athletic training that I'd be an all-girls school and love my job, I probably would have laughed in your face. But I love it there. They do a great job. The athletes try really hard. They do a really good job of, hey, something's coming up, this hurts, and they understand that I'm not a get out of practice free card. You know, they only come to me when it's something legitimate.
Right.
So I try to do my best to make sure they're ready to return to play, and that they return when they're safe, and not just, oh, okay, well, you're maybe feeling a little bit better, let's get you back out there early. No, they have to pass a full functional exam with me when it is an injury, and to make sure that they're cleared to play.
It's so important to have somebody like you on staff there. We've got a caller who wants to ask you a question. Kimberly is on the line from right here in Little Rock. Hi, Kimberly.
Hello.
Hello, we've got you. Go ahead. What's your question?
Yes, I have a 14-year-old that plays soccer, and a couple of games ago he twisted his ankle, and I was wondering, is there any tips on the proper way to actually wrap the ankle so that he doesn't injure it during a game?
Okay.
You know, for preventative care, you start with just your basic ACE wrap. You know, you follow the Rice rule: rest, ice, compression, and elevation when he's not playing soccer. If you do the ACE wrap, make sure you start at the toes and work your way up. You're fighting gravity there a little bit. So you know, a lot of what happens when that ankle swells up is the gravity pulls the swelling down into the joint. And so what you want to do is wrap at the toes and slowly work your way up, getting looser as you go up. That's how to do an ACE wrap for the preventative care and kind of day to day. As far as tape for the ankle to allow him to play, I would really suggest, you know, having an athletic trainer tape the ankle itself. You know, you get some kids that try to go out there and tape themselves, and that can actually cause more harm than good. And then even consider maybe getting an ankle brace. There's tons of ankle braces out there. You can look at places like Academy, Walmart, all these places, Walgreens, all these places have good athletic supporting equipment, and you can do a good job of bracing that ligament.
Very good. Thank you, Kimberly. Go back to Rice just a second. I think I got all the words, but sort of go through that. Is that where you would start, is with rest?
Yeah, anytime there's an injury, you know, rest, ice. So ice helps with the swelling and also with the pain management. And compression, again, working with the to prevent the swelling. And elevation is propping it up and making sure you're battling swelling as well.
Compression is the wrapping.
Compression is the wrap.
And then elevate.
Nice compression. And that's the thing is, swelling is good initially, but after a while, sometimes the light switch doesn't get turned off in your body's defense mechanisms, and it just continues to flood the area with swelling. And sometimes those different mechanical aspects of the healing process can do more damage than good. And that's where you get into things like arthritis and chronic injuries. So you want to control it.
Well, we want you to say hi to all the girls at Mount St. Mary. I think that's great. I hope they're watching.
Yeah, I hope they are too. Hopefully they're in class, so that's not an issue. But
that's true. But it's great to have girls in athletics. It does, you know, so much for their self-confidence, I think, and I'm sure you see that.
It's amazing. My wife and I are expecting our first daughter in a couple months, so I'm kind of hoping that she gets the sports bug too.
Give it a little time. You're getting a little ahead of yourself, but thank you. Congratulations on that, Jeff. And
thank you.
We hope to see you again. This has been fun.
Thank you.
All right.